So miigwech merci beaucoup, and thank you for joining us all today for our Lunchtime Health Sciences webinar. It's entitled Leaping into Occupational Therapy Placements, and it's delivered by David Sprumer and Beth Crutchley. I'm Jen DeBaker. I'm the Programs and Partnership Coordinator for the Health Sciences here at NOSM. And before I get started, I will do some welcomes and introductions. So a reminder about your camera. I know it's a small group today, so you can leave your cameras on if you would like, but if you could mute your microphones, if the audio gets a little off, maybe turning your cameras may help, but when it's a small group, it seems to be okay. So just to remind everyone that this webinar will be recorded today and it will be posted to our YouTube channel at a later date and also on our website. All of our previous webinars are now on YouTube and you can find those links to the recordings either on our RS or NoDip websites or on the NOSM YouTube channel. We will have a question and answer period at the end of the webinar. To take yourself off mute and have a conversation or put some questions in the chat. I will monitor those throughout the presentation. So first, I would like to start by acknowledging the land upon which NOSM is located, to raise awareness of Indigenous presence and land rights, and to acknowledge the colonial history and current history in Ontario and Canada as a whole. The Northern Ontario School of Medicine respectfully acknowledges that the entirety of the school's wider campus of Northern Ontario is on the homelands of the First Nations and Métis peoples. The medical school building at Laurentian University and Lakehead University are located on the territory of the Anishinaabe Nation, specifically Atikameksheng, Wanapatea First Nation, and Fort William First Nations. We humbly ask that wherever you are calling in from today, that you think about the land and area which you reside. Our first speaker today is Naomi Davids-Brumer. She's an assistant professor teaching stream at the Department of Occupational Science and Occupational Therapy at the University of Toronto. Naomi has a BA in psychology, a bachelor's of science, then a master's of science in occupational therapy, and she is pursuing her PhD in health professions education research. Prior to joining U of T, Naomi had worked clinically with adults and older adults with mental illness, in private practice with adults with ABI, musculoskeletal injuries, and chronic pain. As a seating and mobility consultant in long-term care, and worked with a diverse range of employers to complete physical and cognitive job demand assessments. After a short but exhilarating period in clinical research management, Naomi joined the fieldwork team at the U of T and supports students in clinical sites through the students' clinical experiences. Naomi loves to explore and develop new innovative partnerships for OT learners and non-traditional OT roles, and has helped to develop 30 new fieldwork site partnerships for OT departments over the past 18 months. And we also have Beth. Beth Crutchley is a registered occupational therapy practicing in Toronto, Ontario. She works at the CBI Health Group within the psychological trauma program, where she supports individuals to return to work. Her passion includes supporting individuals to participate in meaningful roles and the use of evidence-based approach to treat mental health barriers. Beth is also passionate about mentorship for the U of T OT students and has consistently participated in teaching and mentorship roles since graduation from the Masters of Science in Occupational Therapy program. Merci beaucoup, miigwech, and thank you. Naomi and Beth, thank you for your time today. We truly appreciate your knowledge and we look forward to this talk. Now I'll turn things over to you to share your screen.
Thanks so much. Give me a sec as I get things moving here. Okay, I think we're good. Assuming that's looking good here.
Yeah, that's perfect.
Okay, awesome. Go ahead, Naomi.
That's going to be our AV person, and I just wanted to share that Beth's expertise in LEAP comes from her experience both as a student, completing a LEAP placement when she was a student in the program. She's been a preceptor for us in LEAP placements, and she's also been the TA for our fieldwork course in the past. And so she brings all of that experience in areas that I don't have to this presentation. So it's great to have you with me, Beth, today. And I'll start off with the next slide. So just a quick overview. Today we're going to be talking about LEAP placements, but I'm going to start with a quick review of what OT is and what OTs do, because I'm not sure if everyone in the audience is an OT or is familiar with what we do. We're going to talk about what LEAP placements are and talk about some examples of LEAP placements that U of T's been part of in the past and the benefits of those placements, and then next steps for getting involved in LEAP placements, either setting them up at your site or becoming a preceptor in an existing LEAP. So occupational therapy, or OT, is a type of healthcare that helps solve problems that interfere with a person's ability to do the things that are important to them. What we often call the things they want or need to do. And they're often everyday things. And we put those into different categories, one being self-care. So that's things that people want and need to do around managing their self-care, like getting dressed, eating, moving around their home, around areas like being productive. So that might be going to work, going to school, volunteering, participating in the community, and also leisure activities. So those would be things they want to need to do around sports, leisure, socializing. Gardening might be an example, and these examples are taken from the Canadian Association of Occupational Therapists, which is our national body. And just by way of introduction, OTs are regulated health professionals, and in the province of Ontario, we're regulated by the College of Occupational Therapists of Ontario. And that means that we're sort of bound by and guided by any of the, missing the word, but any of the parameters that guide any other healthcare providers that you might work with. It's a good thing to keep in mind as we talk about sort of how fluid the role is. We still always come back to sort of the parameters that we're able to operate within. So one of the ways I like to think about OT and talk about what we do is to look at three areas where OTs often work with clients. And this is taken from a model of ours called the PEO model, the Person, Environment, Occupation model. So a person doesn't need to be an individual. It can be a group of people or a group of clients. But we look at things like their affective state, their cognitive abilities, and also their physical abilities. Are they recovering from a stroke? Does that impact physically what they're able to do? We look at the environment they're operating in. So that might be their home environment, their school environment, their work environment, the larger sort of political context and environment that we're in. Right now, all of us are sort of operating within a COVID environment, and that we know has significant impact on how we engage with our activities. And so OTs consider the environment that someone's functioning or not functioning within. And the last area is the occupation. So again, that's the thing that they want or need to do, and it might be related to, as we specify, their self-care, their productivity, or their leisure. And as OTs, we sort of look at intervening in one or more of these areas. So are there supports we can put in for the person? Can we teach them how to do something differently? That might help them be able to engage in that occupation, so increasing that overlap. Are there ways we can modify the occupation they're trying to do, or the environment that they're operating within to help a goodness of fit? So as we talk about LEAP, although we're thinking outside the box, these areas still guide the decisions we make and how we think about the possibilities around LEAP placement. So just a quick overview. I'm, of course, familiar with U of T, but I do know that NOSM partners with all of the Ontario universities. But our program is a 2-year master's program, and students enter with undergraduate degrees and some of them with master's degrees in any number of areas. And that really contributes both to the diversity of their interests when they're looking at clinical placements, but also in the skills that they bring to the table when they are working with clients, and sort of the knowledge and expertise that they have from outside of the program. Students complete 1,000 hours of academic coursework and 1,000 hours of clinical or placement hours. And that 1,000 hours is set by the World Federation of Occupational Therapists. And so in order to be an accredited OT program in any country in the world, students need to complete 1,000 hours of clinical placement. And at U of T, those placements are divided into 4 placement blocks that are generally between 6 and 10 weeks in length. And these placements serve as an opportunity to bridge the student's academic work and their clinical practice that they're going to enter when they finish the program. So it gives them an opportunity to be hands-on in a fieldwork site or in a clinical site, and kind of bridging and consolidating what they're learning in class with how that looks when you work with a client. And one of the placement blocks that we do at U of T is called LEAP, and we're going to delve into what that is and what it entails as we chat. So LEAP is an acronym. It stands for Leadership, Role Emerging or Role Enhancing, Advocacy, and Program Development, Program Evaluation. And so these placements are with agencies or organizations that don't employ an OT. That would be the role emerging ones. Or they have an OT who's only present part-time, or they're in a leadership role or an administrative position and not doing sort of clinical work. And those are the more role enhancing placements. So there is some knowledge of OT, but not enough OT or not as much OT as they would like. And ideally, LEAP placements include some combination of clinical duties and responsibilities, and also project work, which may be more independent. It may be done from home. Beth and I are going to talk about some examples to help illustrate that as we move on. So the other interesting thing about LEAP placements, or that's different, is that if a site doesn't have an OT or has very limited access to OT, the supervision of the student is shared by an on-site preceptor and an off-site preceptor. So the on-site preceptor is from within the organization, and they have firsthand knowledge of the site, the clients, the types of work that's done, what's needed, the processes and procedures. And they really provide the orientation to the site and what the site does. And then there's an off-site preceptor who's an OT. And that OT has expertise in what OTs do, our regulatory practices, our scope of practice. What does clinical reasoning look like for an OT? And so together, they support the students in their learning by bringing sort of the expertise from within the organization and the expertise from, within the profession. And when students are in a more, we'll call it traditional placement, where they may be placed on an inpatient neuro unit or stroke unit, they go to the unit, there's an OT who's supervising them and explaining the role and telling them about what types of assessments need to be used and how they get used and who else is on the team. And often in acute care, at least in the GTA, there might be a physical therapist, there might be nurses, there might be a social worker, occupational therapy or physical therapy assistants, physicians and things like that. And so the role of OT in that context is very different to what the role of OT in a LEAP placement might be. The other thing we find with LEAP placements is that although students develop different competencies in all of their placements, LEAP placements force students to develop particular competencies more quickly and more effectively. So in the example I gave before, where a student's on an inpatient stroke unit, there may not be a lot of autonomy or independent problem solving that they need to do because they have an OT right there that they can ask questions to. But when they're on a LEAP placement, their communication skills, their problem solving skills, their time management or self-management skills, and managing the practice environment, those skills are challenged and developed in a really different way. And as we mentioned, that OT on-site, the OT off-site as well as the on-site preceptor, they support the placement experience and the development of these skills because they facilitate opportunities, but they don't necessarily provide answers in the way that a student might get them in a more conventional placement. So there's a lot more outside the box thinking on the part of everyone, but um, although it can be challenging for students, we find that they really come out of these placements with a good sense of what OTs do and where they add value. I'm turning it over to you, Beth.
Yeah, okay. So I'm gonna kind of continue a little bit of what Naomi's already been speaking to, really focusing on what the roles and the responsibilities are of the different parties involved in elite placement. So obviously we have the students, and their focus is going to be engaging in projects throughout their placement. They might be clinically focused, they might be more non-clinical, but either way, they're engaged in different projects. Usually students have at least one. That's what we've seen. But as Naomi said, there's an emphasis on them engaging in the competencies around leadership, around organization, around coordinating. And we prepare them for their LEAP placement experience by emphasizing how they will be managing so much of this placement experience and taking less of that responsibility off of the preceptors. So early on, even in the placement, students are encouraged to schedule meetings and clarify the rules with the preceptors. They're in charge of determining what the expectations are and what their, the deadlines are, for example. They should be the ones who are driving those discussions. So the on-site preceptors, these are often managers and coordinators. And generally we see non-OT healthcare professionals in this role. This varies, and the knowledge or familiarity with OT can definitely vary between sites, between LEAP sites that we've seen. But this is typical because on site, the roles of these preceptors will be involved in coordinating or facilitating any parts of the projects that are specific to the site. So if the students are involved in meeting with clients, maybe they have a small project where they're interviewing clients for a clinical-based project, the on-site preceptors, regardless of their being a healthcare provider or not, they might facilitate the students to connect with the physiotherapist who's on site, or connecting with the clients in some capacity, or any stakeholder that's important. And they are absolutely able to provide comment on the competencies for students. So they may not have that OT lens if they are more of a coordinator, but there's tons of opportunity for offering feedback on organizational skills, on communication, on how the students are doing with taking on that independent or that autonomous role. So there's still a lot of opportunity to build the competencies with the students, even if they're not the OT. And speaking to the offsite preceptor, so this will generally always be an OT. And U of T, we've typically been, we facilitate connecting sites with an OT if it isn't immediately obvious, if there isn't one set up. We do this in with most placements, I would say, with most LEAP placements. And really what the role of that offsite OT is to support the students in developing their learning objectives. So what are they going to get out of their placement? Really early on, setting up that their goals are in line with the OT scope, and that they are looking to have learning opportunities that are going to further their skills, even if they seem very far from what a traditional role might be. So that OT offsite preceptor, they will definitely be involved in debriefing any sort of clinical experience with the students, supporting them to consider other competencies. So clinical knowledge, for example, thinking about their practice setting, and deliver feedback to the students at midterm and final around any issues that come up. The OT offsite preceptor is really helpful in supporting the students to lean into that self-directed autonomous role during LEAP. And a lot of the time we contextualize this by saying, not too long after they finish that placement, they will be working out in the real world, so to speak, and they will have to take on these responsibilities. So there's very much an emphasis to embrace that and to self-direct, problem solve independently. So the offsite OT preceptor also can speak to regulatory issues or just information related to the college. So consent, scope of practice, these are great conversations and questions that might come up. and generally supporting the students to balance what their placement projects might be. It's really common. We see amazing sites, so excited to have students, and they throw like 10 different project ideas at the students, and it's very overwhelming. They're all exciting, but the OT can really help narrow what can the students do in that very short 8 or 10-week period. So that's where they come in as well. Just speaking a little bit more to what those projects are. So we've mentioned, obviously, they're engaged in projects. So this is just a slide that breaks down what that might look like. So the clinical work, this is any opportunity where the students have direct face-to-face or virtual contact with clients or patients. So it could be administering assessments or providing treatment if the setting or the context allows for that, if there's an opportunity. Maybe they're, again, speaking to that emerging role of the OT. Maybe there's an OT working in a different department of the center, and we want to trial using some of that skill in a different area. So the clinical work can also involve preparing for the client sessions. So either it's individual or group, reviewing charts with consent. It could be, having a conversation with preceptors, with healthcare providers about the client or the patient before. Could be driving to meet with the clients in their homes for home assessments in the community. And this involves record keeping and, again, debriefing and anything involved in that clinical role. So related to that is where we see a lot of students taking on clinical projects. So it's less about having just that clinical experience and managing how an assessment or treatment session might go, but looking at if something can be furthered. We often see maybe students are developing group programming or group protocols. Maybe they want to have almost like a little bit of an investigation of how it might work to have a certain kind of group setting happen in a clinic or in a new setting. So, maybe they want to try a mindfulness program and see if the patients or the clients from this setting might enjoy it, and if it's going to be something helpful or an adjunct to treatment. The clinical projects may be looking at developing health-specific information, maybe compiling resources, and a needs analysis is a really amazing kind of project that we see quite often, where students are actually meeting with patients or clients at a site and learning from them what is missing from their treatment, what is missing from their circle of care, and seeing where that OT role can fit in. Often these clinical projects will end with some sort of presentation or more like a little bit of a formalized project to kind of summarize what they found. And so, of course, non-clinical projects are quite common in LEAP placements too, where students are looking at developing program protocols, maybe formalizing processes. We'll get to some examples in a few moments. Something we see often is students looking into resources for sites. So it could be, we know that there's lots of online resources, online tools, apps that are used. Maybe a site is looking to have some sort of a database for this, or resources that are compiled somewhere. And this is an amazing kind of project where the students can do this for the site and offer their expertise in identifying what would be helpful. Any sort of materials or resources that can be refined, students are absolutely involved in this on different LEAP placements, and literature review, looking more at the evidence-based practices behind some sort of treatment or data analysis. This is also done during LEAP. So just to give you a sense of what happens on LEAP, we just wanted to break down 2 hypothetical days, what they might look like. There is no typical day for a LEAP placement, or for any student for that matter, but this is just to highlight the flexibility in how the placements might feel. As Naomi mentioned, we think about the traditional role, maybe in the rehab inpatient unit, where there's the OT, they're kind of full-time supervision. They kind of know where their student is. With LEAP, maybe the students have that for a portion of their placement, but then there's that independent work. So just one example, it's a day that involves on-site and off-site work, where the students arrive in the morning, they work on some independent work together and prepare for meeting with clients for a project. They meet with their clients, they complete some documentation, and then they spend the latter half of the day perhaps at home, where they engage in some work independently. Maybe they communicate together remotely, and then they have an end of the day meeting with their OT preceptor where they can debrief their meetings. And so this is a mix between independent work and being on site with, in close proximity to their team. And another day is much more remote, where the students are, they maybe start their day with a virtual fieldwork meeting where the whole fieldwork team is involved. So the students, on-site and off-site preceptors, they check in the morning, and then independent work is completed throughout the day, including emailing and students reaching out to the clients to do screening for their interviews, and ending the day with a check-in session. So two different kinds of days. This could be the same students who are doing the same projects, and this is the kind of flexibility that not only we see, but it's allowed, and we encourage it because that's what makes for this kind of placement experience. So I'm going to speak now to why having a leaf placement is good for your site as well. We obviously see that there's a great opportunity for rich learning for the students, but we find that the sites themselves, or the centers that take on the students, there are significant benefits that have shown through. So a LEAP placement might impact your clients or patients, and this is for a few reasons. So we see that students are so passionate about working with patients and clients directly, and they are so excited to bring their inquisitive and client-centered nature to the placements, and we see that clients definitely benefit from this, and it's something that is very symbiotic in that the clients get to work with someone who is young and eager to learn, and we know the benefits of that. We see that students are also very passionate about seeing how teams operate. So if there's a setting that is a little bit different from that traditional role, they are often curious to see how they might fit in and use that OT lens to discover what that could look like if they brought their expertise. There's also leadership opportunities that we see as well, where having an OT student on your site could be that piece that's missing to talk about, what is the client's home like? Maybe they were finally able to have an assessment for the client's mobility in their bathroom, which hasn't been done yet because that role hasn't existed. So there's actually that opportunity to bring knowledge into the placement and then benefit the client from that. We also see students consistently develop projects that are about educating the clients and patients at the site. This is a wonderful role for OTs because of our very holistic lens. We've seen students consistently create workshops or education sessions, lunch and learn kind of projects where they are focused on whatever the needs are in that population. It could be mindfulness-based, could be falls prevention, ergonomics, and this has definitely been a way to directly impact the clients and patients at a site. So impacting your team members or employees, this is something that's also possible by having a leave placement. So we know that we all have at least one or two ideas of projects or maybe smaller kind of scale ideas that we want to implement on our site, but it's very hard to do that when we're busy, when we're working, right? So this is an opportunity for students to jump in with a little bit of a setup for them to take on those projects and actually develop content. Maybe it's organizing something on more of a administrative level even. Maybe it's something to do with the organization of a team. It can be different from that clinical perspective necessarily too. So there's definitely flexibility in what this could be, but students are often seen doing this on LEAP placements. Thinking about the leadership opportunities for team members and employees, we've often seen students team up with managers or individuals in more of a management position where they want to implement some sort of change or some sort of new protocol within their team. And this is something that LEAP students have done as well. And we've seen incredible projects that have come through during LEAP where students educate or support actual team members. So we have mindfulness-based groups for clients, but we've also seen this being done with staff members. We've seen education sessions for what OT is for staff members, for team members. And this is something that's promoted not only our role, but giving team members that perspective of what could, something else that they could bring to their knowledge base. And they've seemed to have a lot of positive feedback about that. Okay, and lastly, we have the clinical team or the department that also might benefit. So we know that having a student close to you, even for a portion of the placement, it's going to have us reflect on some of our clinical practices, and this strengthens the team because it does keep you on your toes at times, and it's very it's an interesting experience, obviously, to have a student, but it's positive in that you are asked questions about something, or maybe it's just an obvious question about why something didn't work, and it keeps us reflective, which is really important to the OT role. So having an OT student involved in a team meeting, for example, this can support the clinical decision-making process as well. Again, speaking to the OT student who saw the client at home, they could offer that knowledge to the team decision about discharge, and give that kind of perspective, which is invaluable. And also just providing that different perspective. So this is speaking to when specifically there is no OT on the team, and bringing that lens and offering that and allowing the team to decide, if this is also something that's really important, if this is a perspective that is, it benefits the team, benefits the clients as well. The needs assessment, we mentioned that a little bit earlier, this kind of project where the students are meeting with clients, meeting with patients, determining what's missing, what kind of care do you feel would be helpful, maybe identifying themselves something about the client care, and then reporting back to the team and saying this is where an OT might be a great fit. And working with or within untapped areas is also where we might see benefit. An example of this is having OTs in the emergency room. This is something that's definitely an emerging role, and we've seen some placement settings have this, where it's also an opportunity to have students trial being in that environment, doing a bit of research, and seeing how they might be able to bring that kind of perspective to that setting. Hey, Naomi.
Yeah, so I'm going to talk about some we'll call them leaps of success, but these are some placements that our students have participated in the past, that have been really valuable. But as Beth was talking, I also was reminded of a student of ours a couple of years ago who prepared sort of an accompaniment for swim instructors at a particular large community agency on working with neurodiverse swim students. So looking at, if any of you remember back to your swimming lessons, if you didn't get it right, your swim instructor would maybe put their hand on yours and help you with the stroke. And that isn't an approach that will be readily accepted or helpful for every learner. And so looking at typical, in this case, was pediatric issues that might arise, and developing resources that helped explain what some of those issues might be around development and sensory, and making some recommendations. And that was something that the site could share with all of their swim instructors. So just that's another sort of example, I think, that I thought of when Beth was sharing about where can they support the employees or the staff within an organization to do their roles, by having a different perspective available. So I want to share a couple of other stories. So we had a couple of students who worked in a psychology practice last summer, and this is a practice that employs about 18 psychologists and social workers, and they work very very closely with a trauma-informed perspective. And they shared with us after the placement that they actually hired both of our OTs as new grads with their provisional licensing, because what they found was that the approach that the students had and that OT lens had was such a great adjunct to the work they did. And they gave me an example of a client they had been working with for several years who was sleeping on their couch. And the OT students came in and used more of a behavioral activation approach and set some really clear goals with this client. And within 3 sessions, working with the OT students, this person was back sleeping in their bed. And just even the client's ability to see that they were able to make changes was so valuable to moving, their other counseling forward, but for them in the practice as well. They just were so clearly able to see that when there's a different approach that can be paired with what they're doing, there can be real value to the clients. And for us, of course, it was great that the students ended up, getting positions with this organization to continue the work that they were doing. We've had students who over COVID had worked with a community center, and they had 2 large projects. One was to do ergonomic work with the employees who are now working from home. So again, it's a project because it sort of has a defined start and end, but it's very clinical because it uses all those skills that they had to assess these employees virtually in their home environments and make recommendations of how they can modify their workspaces to make it ergonomically more sound for them, and help alleviate some of those aches and pains, which is a win for all of us when we're working from home, and it's a win for an organization when their employees are comfortable in their emergency home workspaces. And another thing they offered that team was weekly mindfulness sessions for the staff. So that allowed them to help manage their stress levels better. But the OTs were able to sort of look at a really sort of physical health issue and a mental health issue. And their clients in that instance were employees of this community center. We've had students work with newly housed individuals in downtown Toronto. And what we do know is sometimes when people have been out of stable housing for long periods of time, some of the life skills that we take for granted in terms of being able to manage our budget, to pay our rent on time, being able to plan what we need to buy at the grocery store so we have food to eat, being able to do our laundry. These are skills that some of these clients may not have used for years. And so having OT students come in and support the life skills sort of development or redevelopment for some of these newly housed individuals really help them maintain their housing in a more effective way than just kind of putting them in housing and hoping they would remember or know how to do these things that they may not have done, in some cases for 10 or 15 years. And then one opportunity that I'm really excited to highlight is that we have our very first partnership between U of T and a LEAP placement in the Nauseam catchment area. So we have a student, and Martin, who's on the call, will be supporting the student. We have a student who's going to be doing her LEAP placement with the Englehart District Family Health Team, who's given me permission to give them a shout out. But she's going to be supported by the nurse practitioner on the family health team and Martin, who's an OT who works on other family health teams in the same region or nearby community, who's going to be serving as her offsite preceptor. So this is really exciting for us and hopefully for NOSM as well. But these are students who really wanted the opportunities to form connections in their home communities up in the north, even though they're in school in the GTA, so that when they come back after school is finished and they're trained as OTs, they have a professional network that they can use, and we have no doubt that that will be really valuable for them when they come back to work up in the north. And I'll turn it back to you, Beth, to highlight some of the projects. And then we'll wrap up.
Yeah. So here, I just wanted to speak to a couple non-clinical LEAP projects that were really successful or that we saw were beneficial for the sites as well as the students. So I'm actually going to speak to the LEAP placement that I was on when I was a student, and it was looking at a fitness program in Toronto that was for individuals with mental health and or addictions concerns. And my role for this placement was to essentially just work on program development. And we did this by strengthening relationships with community partners and basically seeing like who is willing to refer individuals to this program. How can we share the knowledge that it exists? How can we promote it? How can we promote inclusivity within that? And along with that as well, I found that developing some education for the staff members at the fitness center around mental health, around inclusivity was really valuable too. I still work for this program, and we also had two other LEAP placements at this site after I finished school and I finished this placement. So it was something where we were able to continue supporting the program with students and continue it along as well, even during COVID. And another example is where we see kind of generally a lot of students on LEAP will focus on developing modules or program guidelines. Again, this is non-clinical, but this is so important for so many sites. We recently saw two students working in a hospital based in Toronto where they were working on taking an evidence-based approach and essentially just formalizing it, making kind of like a presentation for clinicians that's easy to follow, and working closely with the preceptors to create this and then sharing it with staff members. So those clinicians who are busy, maybe they know about this new practice, maybe they want to implement it, but here's actually the guidelines of how to do this. And there was some evaluative component as well. And we see that creating some best practice modules has been really successful for sites. Another example is also recently OTs or OT students were on placement with a center that had a lot of occupational therapy assistants. And the OT students came in and developed these incredible learning modules for the OTAs and gave them knowledge about social, psychosocial aspects. I think there were mindfulness approaches as well, and offering their lens and helping further their education specific to the clients that they would see at that site. So all of these examples here they're non-clinical, but incredibly helpful, incredibly supportive of the site and giving the students a really interesting learning opportunity where there is a ton of autonomy, leadership, and really benefiting their knowledge base as well. Get this moving.
Yeah, so I'm just going to wrap it up with highlighting a few important considerations. And these are considerations that you don't have to solve on your own, but they're important for us to keep in mind. And the university is available to help with coaching through some of these conversations, as is, the college is always available for practice questions. But depending on the type of setting that you work in, how consent is managed, and does it include OT services? Are clients aware that there's an offsite OT preceptor who may be viewing their records or being consulted with on how to manage the care? All of those pieces need to be considered when you're bringing in an OT student, and there maybe aren't OTs on site that clients need to be aware they're consenting to, and know who's going to be involved. The other piece around that is also that overlaps with that is record keeping. So again, is this a clinical site? And then if it isn't, then who is the healthcare custodian? Who is keeping these records? And if it is, who is signing off on the student notes? And so all of those questions are things that we can help sites discuss, but that, we want to make sure everyone's aware of. And I think Beth touched on some of these earlier as well. And then one sort of recommendation we have is just figuring out between the placement team, which would be the students, the on-site preceptor, and the off-site preceptor, what does our meeting schedule look like? So Beth shared like 2 typical days that might happen, but there may also be a placement that's very heavily project oriented, where the students and the preceptors may meet on Monday and then may meet again on Thursday, and not necessarily touch base every day unless a question comes up that gets answered by email. So figuring out what are the meeting times for the whole placement team, and then do the students need separate meetings with either their on-site or their off-site preceptors, and who's taking the lead on these meetings, who's setting the agendas, to ensure that the students are supported in the way that they need, but also that they're encouraged to really take charge and take the initiative as they move into the sort of latter half of their clinical training. Next slide, Beth. Yeah. So just a summary. So LEAP placements present opportunities to explore how to grow the OT role at your site or to explore it. And Beth mentioned, like, there's always projects that we don't get to, and perhaps one of those projects could be a placement for students where they can help with figuring out with their flexibility, what could the focus be and how can that support our clients, our clinical team, and our department or our site. So that's just a little summary. And then before we turn it on to questions, just the next steps, if you want to get involved. We at U of T have a spring and a summer opportunity for LEAP placements. So if you're an OT who wants to get involved as an offsite preceptor, or if you're a fieldwork site that wants to explore LEAP placements, your next step would be to contact Jen, Jen DeBaker here at NAWSM, and connect with her about your interest. And then we can sit down as a team with myself and Jen and you to sort of explore your questions and brainstorm and see what the possibilities are, and go from there. And I'm always happy to answer questions about LEAP. I love talking about LEAP. I feel like the possibilities are really endless when we think outside the box. And so Beth and I will turn it over for questions now. If you have any specific questions, we'll be happy to do our best to answer those.
Thank you, Naomi and Beth. That was wonderful. I'm not sure if anyone has any specific questions. And feel free to turn your videos back on. I know it's a small group.
I have a question here. It's Jenny. I Hi, Beth and Naomi. Thanks for that presentation. It was really good. So I'm an OT by background, and I'm also the clinical learning liaison for NOSM placements. So I just had a question about, like, do you usually see that you're grouping like several students at one of these sites, or is it one student?
Yeah, so that's a great question. And the answer is always that it depends. So what we find with LEAP placements is they're often really successful when students come as a pair because it means they use each other as a resource. So, oh, we have this project, I don't know how to approach it. If they have another OT student that they can problem solve with, that often works really well. But not all sites can support two students for any number of reasons, COVID being only one of them. So we certainly can send students sort of solo. Um, those are some considerations that like we try and make sure sites are aware of, that we find even though you have two students to give feedback on, the load, the supervisory load might still be lighter if you take two students rather than one. Um, and it also depends on sort of the scope of the project and how big it is and whether there's sort of enough there to keep two students busy rather than one.
Okay. Um, Now I have another question about like blocks. Like I've seen that you guys are looking for like spring and summer, but do you usually have LEAP placements like in the fall, winter as well, or are they typically, because I'm just recalling back to when I was a student for like the role emerging placement. I think it was on a Friday typically, and I still was doing coursework the other days. So that's where but my placement was, I went to Queens, my placement was in Kingston. So it was easy to incorporate that. I'm just thinking of students like wanting to come back to the north, if they're in class, like in Toronto, right? It may be harder to coordinate. So can you speak to that?
Yeah, so I can't speak to the Queen's program. For U of T, our role emerging placements are either in the spring when 4 days a week is dedicated to their placement and 1 day a week is blocked for their research project. So, if their research is such that they have to be in the GTA because they're, meeting with a client that they need to interview every Wednesday, there's not a lot of flexibility. They may not be able to participate in that, but a lot of our students, especially by the time they get to Fieldwork 3 in the spring, are in that more sort of independent stage of their research. They're doing their writing, and so they're able to manage sort of being out of the university's catchment to do a placement. And then in the summer, it's their final placement. They're finished all of their coursework, and so all they're doing is placement. And so we don't have that split, it sounds like that Queens does, where they're in class some days and doing a placement some of the days. That may be different if you're looking at a student from a different university.
Okay. And so it would typically be a second year student then.
We try as much as possible to have the students who are on their more like their third or fourth placement block, where they've accrued a lot more of their skills. They've had other placements where they have more support, and then they're able to be a bit more independent by pulling from that clinical learning from previous placements as they come to do their LEAP.
Great, thank you.
I'm still seeing the slides up, but I can't see everybody.
I
But
was just going to say I might stop sharing just to bring everyone back. Here we go.
Yeah, and I know Chantel, you had mentioned that you weren't sure if this was appropriate for you to attend, but as you can see, you could be an offsite preceptor to any sites you think in Fort Frances would be appropriate for a placement like this. And again, feel free to email me if you have any suggestions. I'm always open to any suggestions for new sites. So thank you for attending, all of you. And I've learned so much from Naomi and Beth and over the last few months about the LEAP placements. So thank you. And I know, Mike, I think you had something to say.
Yeah, actually, no, I had a question. And thank you for a great overview of LEAP placements. And you talked about some examples. And I was just curious in terms of defining what a successful LEAP placement looks like, and specifically in relation to kind of the role emerging component of LEAP placements. If you have collected any data, if you have plans to collect data on kind of whether or not any of these organizations that are offering LEAP placements end up developing an OT position.
Yeah, so I don't know that there's any way that we're formally collecting data on how many turn into job opportunities, just because the way I think our graduates end up providing that information back to the department, it doesn't necessarily come back to the fieldwork team. I think what we know of is more anecdotal. When students reach out to us or sites reach out to us, we hear, or when another offer comes in from a site and it's no longer role emerging because they have now an OT that they employ. But I do see that Rona turned on her camera, and I don't know if that's because, so Rona's our director of clinical education, and she may have some other thoughts about how it gets tracked that I'm not even aware of. So I'll just turn it over to you, Rona.
Thanks, Naomi. No, great response and great question, Mike. We actually, within the Department of OS and OT, have a curriculum committee, and there's a subgroup of that committee that is specific to leadership. So it's an area that we wanted to develop in multiple areas of our curriculum, so the clinical education and the academic components. And so Andrea Duncan, who I think many of you may have met before, she is currently the lead of this committee. I'm a member of it. And what I can say is it's something our committee is talking about is research. Actually, Andrea is on study leave at the moment. And so we are looking into different research opportunities so that, as Naomi mentioned, that we have more, less anecdotal and more research to back up the work that's being done and look at the outcomes in a more systematic way. So thank you.
It's great. Thank you very much, Ron. Well, Martin, you excited?
Yeah, absolutely. This presentation is actually very helpful. I know we had a quick chat a few weeks ago, which kind of gave me a brief overview, but I think I myself would have loved to participate in this kind of thing maybe just a few years back before I started this position. It would have probably helped me out. So I think it'll be very fun to go through this process with our student and potentially other ones in the future. Absolutely.
We're delighted, Martin, to have you as part of that. The team working on this, we'll call it the inaugural NOSM LEAP placement.
No pressure, right?
no pressure on any of us, but I've no doubt it's going to turn out really well. And I know everyone who's involved is really excited. So it's really great to have someone who knows the community part of that placement as well.
It's good. Yeah, thanks for the presentation. It was very clear and very well put together. So thanks a lot.
Yeah, thank you.
Yeah, so I just want to say thank you for today, both of you, Naomi and Beth, taking your time. We appreciate it here at NOSM, and we really appreciate your partnership. And I'm really excited to hear how the first NOSM LEAP placement goes. So thank you, all of you.
Thank you. Thanks for having us.
Bye.